Visant, transforming healthcare through pharmacy.
Hi, I'm Erick Siegenthaler, and I'm our Senior Director for Infusion Strategy at Visant. So many organizations will ask, why now? Why should we look at our infusion program today? There are many other challenges that health systems and pharmacy departments are facing. What we see is really an opportunity both to grow services that can be provided and leverage opportunity, but also to shore up some risks, frankly, that health systems face. Organizations may have looked at home infusion in the past, which traditionally has focused around post-acute care. So patients leaving the hospital getting things like antibiotics or TPN, but today's home infusion really is expanded into specialty infusion. So anything that you've provided within your hospital-based infusion clinics likely is being provided within a home setting or an infusion suite setting today. So the opportunity, or why now, is you're likely losing business to outside providers. And what we say is, look in your market, just search infusion and your market, and you'll likely find new companies popping up to support your patients. And so we can come in and say, here's objectively what opportunity is there, what you're losing, and where that's at. So now is the chance to get ahead and beat some of those private market companies to the punch and get in and really establish the ground and make sure that you're providing services to your patients. Pharmacies know well, the best care for a patient is done within the organization, and infusion is not unlike any other area. More and more drugs are also coming to market. Typically, they're going to be complex, high dollar, specialty. And now with things like payer set of care, really, as products come onto formulary, payers are saying, where can this be administered? And often that may be outside of your hospital. Some organizations may be worried about cannibalizing their own business. We believe that organizations are already losing those services outside. So by supporting these alternate sites, we can capture patients and again, put them in the right place. Some patients may need a hospital level of care, and some patients may only need or may prefer a home setting for care. And I think ultimately your providers will appreciate this. It'll help to keep the services internally, also helps to reduce some of the workload on them. So organizations within their infusion area are challenged by a few things, particularly payer white bagging, as well as site of care restrictions. So why now? Really, we look at how that impacts both patients and providers. A provider wants a patient to get a medication that's infused. They're likely going to place an order. They're going into a queue and getting authorized, and patients are getting their meds. What we see now with payer restrictions is there's increasing complexity around what providers need to do to be able to get their patients access to those meds. So from a site of care standpoint now, within organizations, a provider may order a medication, we attempt to get authorization, and it is denied. The patient must go to an alternate site of care. So that then puts a lot of work back on the provider or a nurse within the clinic to figure out, where do I send the patient? How do I put in orders? How do I do this all? The other area from a care coordination standpoint is white bagging. So when patients need to receive their specialty infused product from an outside pharmacy, that puts a lot of work on either a pharmacy department or the clinic to manage which patients are getting their medications from where, when do we need it, how do we store it, where is it going to be delivered, all of the challenges that we're aware of. Really, by setting up alternate site infusion or home infusion, we can try to take some of those services and centralize them and take that work back off of the clinics. So if you are getting a denial for a site of care, okay, that'll just move to our alternate site, whether it's a pharmacy infusion suite or home infusion, and reduce some of that rework and confusion for the provider. We also see these challenges create similar issues for patients. Many patients may be receiving an infused product for a chronic disease over a long period of time, and suddenly their insurance may change or their plan may change and say, you can't get your service here anymore. So really that takes someone that's got a very stably managed disease and creates some anxiety as well as potential for gaps in care, which from a patient care standpoint can be quite damaging. The other area that we see from a why now standpoint is more around the non-oncology areas, so GI, neurology, rheumatology. What we're seeing increasingly so, and we anticipate this will continue to expand, is some of the oncology products that are new to market. As they come to market, payers are going to be looking at costs. How can we manage the cost of these very expensive drugs? And we do see these products beginning to come onto site of care lists and white bagging lists as well. So what might have been really focused around your non-oncology areas may expand to other areas. So again, Setting up alternate options and really the whole continuum of care sets your organization up in a place where you can provide care to a patient in some place, whether that's hospital, an infusion suite, a physician office, or the home. We want to be able to fill in those gaps wherever those may be. Ultimately, improving patient care, supporting your providers and your clinic staff in access to care, and then lastly, driving financial performance.
Visant. Visit us online for more information.